Well, hello, everybody. Welcome again to Start or Sit podcast. Again, going into week 14 of the NFL season. Dr. Hawkins, week 14, my gosh, these people or these athletes, they play a lot of games. It's an aggressive sport. It's a highly contact type sport. You can't help but notice all the injuries. This time of year, there's a lot of these nagging injuries, and I don't know, sometimes athletes just play so much, there might be a tendency to get hurt or be more prone to injuries as the season progresses. So we're going to talk about some significant injuries here this week. You ready?
Yeah, it's perfect, Shannon.
Yeah, okay. Let's talk about Tyrod Taylor, Houston quarterback. It looks like he has a torn ligaments in his left wrist. We haven't had a wrist injury in a little while. Talk about what do you think is going on there, and what is his possibility of returning to play with, 2 or 3 games left this season?
Yeah, so the first thing to take into account is what you mentioned. It's his left wrist, so it's not his throwing hand. So I think if you were in a situation where they were a playoff team and they had a lot riding on things, there's a chance he'd try to play. Just tape up the wrist, give it some support, because that's just where he needs to receive the snap. That being said, we've talked about ligament injuries in other parts of the body. Those are like ropes. They go bone to bone, and they help to stabilize things. The problem with your wrist is you've got a whole bunch of little bones in your wrist. So we've got 8 bones across the middle of the wrist, and then that attaches to the 2 bones of your forearm. So a ligament injury there, and they haven't been real specific on exactly what happened, can be very problematic in the long term. So you can play through those injuries, but then that can start to lead to secondary problems that lead to loss of mobility and arthritis and other issues. So a lot of ligament injuries, if it's truly a tear, those oftentimes will be surgical at some point. So I think he's probably going to be unlikely to be playing. I think he'll be a sit. But I think they'll keep him active in case, I believe it's Davis Mills is his backup, who's now going to be the starter. If Davis Mills were to go out, say, with a concussion or something in game, I think they would keep him around to be able to put him in. But if you're using him in fantasy, I think he's a sit.
Yeah, I would agree. Based on what you just described, his need to have that left wrist somewhat functional, although it's not his throwing hand, but you're right, he's got to take the snap hand off. We saw that the other night, just how important the hand is. Who dislocated their pinky finger? Maybe we can chat about that real quick while we're on this topic. Quarterback, I can't really remember. Do you remember who dislocated their pinky finger the other night?
No, I don't actually.
Well,
apologies on that.
No, I'm drawing a blank here, but it was obviously watching the player. Oh, it was Joe Burrows, I think it was, and he was actually handing off the football with the hand that he normally doesn't hand off just to protect his pinky. On TV, it was obviously the small finger, the pinky finger was dislocated. And although it is not his dominant hand, it affected everything he did. It was quite interesting to watch. So thanks for the update on Tyrod Taylor. He's most likely sitting. Kenyon Drake, running back, Las Vegas Raiders, broken ankle. He is most likely out, but let's talk about that.
Yeah, so he had not a true horse collar injury, but the type of thing that happens where you get dragged down from behind and the player rolled up onto his ankle from behind, and those can be bad injuries. Oftentimes ligament damage, but in this case it resulted in a fracture. He will be out for the rest of the season. They have not been clear as far as if he was definitely going to surgery. I would assume he is having surgery for this, with it being an ankle fracture. That's unlikely, even in a situation where it's a non-displaced fracture. In an athlete who's going to be trying to rehab and come back, a lot of times they'll simply put a plate or a screw on it to keep it in place so they can be a little more aggressive with the rehab and move him a little quicker.
Do you think this is possibly one of those fracture dislocations? I mean, the mechanism of injury, you talk about a kind of a tackle, kind of probably stressed his ankle. Would that talus or that ankle bone have popped out and dislocated and fractured either what we call the malleoli? Is that what you're assuming here?
Yeah, exactly. And so if everybody can kind of remember the pictures from a year ago when Dak Prescott had his ankle injury and, they looked down and the foot was pointed 90 degrees, that's where the 2 bones in the lower part of your leg, your tibia and your fibula, create sort of a box that allows that talus bone to hinge in between. And so if you spin the ankle sideways, you either tear ligaments to spread those bones apart, or the bones break, and that's where you fracture the malleoli, the bottom part of those bones, and that's typically what would require a plate and screws to stabilize them and align them appropriately.
Okay, bottom line, he is definitely out for the remainder of the season. That's Kenyon Drake. He is sitting. Corey Davis, New York Jets. Here's an interesting one. We've talked about groin strains a little bit, but this is a groin strain that's going to require, it looks like some type of surgery. You know, we normally don't really talk about surgery with groin injuries, but what's going on here?
Yeah, he's interesting because he's kind of had a little progression. I think at one point he was kind of out with what they described as a hip flexor injury, and now we're talking about they use the term core muscle injury. So some people have heard the diagnosis of a sports hernia, and I think this is probably that type of a situation. And it's interesting. You can talk to a lot of specialists in this area, and they're all a little nebulous about what exactly a sports hernia is. But we're talking about the lower abdominal muscles and kind of how they come together and attach to the pelvic bone itself. And then there's actually what's called the pelvic floor, which is muscles that kind of support things below that level. And so the junction of those muscles, oftentimes in athletes, can kind of get strained. It's different than a hernia like an old person like me might get, where we're talking about a weakness in the abdominal wall that allows, say, your intestines to actually push out through it. This is lower down, and it has to do with the ability to generate power and force. And so that's become an area that gets treated in these athletes because of the high stress they put in that area. But I think he probably started off with something that was mild, and he's been trying to play through it, and it just keeps happening. So he probably saw one of these sports hernia specialists, and they basically said, listen, we're going to shut you down. We're going to do a surgery where basically they go in and sort of imbricate that tissue. They take sutures and essentially tighten it up. Sometimes they'll reattach to the bone itself, and then they'll let it rest and heal.
This is interesting enough because we hear about sports hernias, but what is the mechanism of injury? Is it just a stress to the muscles, a pull, a tear, and then it causes that weakness in that pelvic floor that you described?
Yeah, I think most of the time when you see these things, they're an accumulation of low-level trauma, obviously in a high-level athlete, but it's an accumulation. It's not a sudden, pop where it pulls off all at once. Those tend to be with the larger major muscle groups. We've talked about the groin injuries where it's like a flexor muscle from your thigh coming up and attaching. Like I said, these are core muscles that involve stabilizing your trunk to your pelvis. And like I said, those I think are an accumulation of small injuries over time.
Okay, he is definitely a sit then. Corey Davis is sitting for the New York Jets. Tight ends. Let's talk about Logan Thomas, Washington football team. He has what they describe here as a significant knee injury, but positive side, apparently no ACL involvement. But he is questionable, it looks like.
Yeah, he took a pretty decent hit, and the replays, they were speculating right away that it had to be an ACL injury because he kind of had that sideways motion at his knee, and a lot of times that starts off as an MCL injury. So on the medial, the inside aspect of the knee, that's the first ligament that kind of goes, and then if the tibia, the lower bone, continues to sort of bend out to the side, then you can get the ACL next. So that ACL-MCL combo is what was feared. Apparently, he got an MRI, and the ACL was not torn. Now, there is such a thing as partial tears of the ACL, and there's definitely situations where you can sprain that ligament. So I think they're hopeful that they'll let things calm down. They'll see how his stability feels on examination. And I think they're hopeful, based on the MRI not being conclusive for an ACL injury, that this will just be an MCL. But this guy's been fighting problems. He was out a bunch with hamstring issues earlier in the year, and so he'll be a sit this week. And I have a feeling that they will probably just shelve him for the rest of the year, even if it's just an MCL injury.
Okay, so definitely a sit this week. Coming into this week of week 14, Logan Thomas is sitting with the likelihood that may be out for the season, but we'll track that and follow that. Here's a wide receiver. This guy has been plagued for the last several weeks also. Adam Thielen, Minnesota Vikings wide receiver. He's got a problem with his ankle, just not going away.
Yeah, and he actually did get, another situation where kind of got rolled up and twisted it. And again, I think it's a situation where they were fearing the Kenyon Drake issue might have happened, where he might have actually ended up with a fracture. But it turns out it's a high ankle sprain, and we've touched on the difference in the past about how the low ankle sprains, you can get lucky with those, you can tape them up. The high ankle sprain starts to compromise the ability of those two lower bones in your leg, your tibia and fibula, to be stable together. And so they are more problematic. They take longer to get better. And in a wide receiver, I think that's going to compromise his ability to do things. So I think he'll be a sit. I think they'll be aggressive with him, though, because they do have a chance to get into the playoffs. And so he may be somebody that tries to gut it out with a brace or taping it and shut down his mobility. But for this week, I believe he'll be a sit.
Yeah, he's a sit, but you're exactly right. I agree with you. They are in the hunt. They look pretty good at times. Got beat the other night, but I think they've got potential, and he's a big part of their team. So you're saying sit this week with the possibility of the following week probably be back, depending on examination and ability to do what he needs to do on the field.
Exactly.
All right, Dr. Hawkins, that's all the time we have. Great stuff. Once again, thanks for your information. Great descriptions. You do a great job providing our listeners kind of the visual of the injury and why that athlete will probably sit or start. So thank you for your time.
Yeah, it's been wonderful. Thanks again.